How does FVC help diagnose and manage asthma? Imagine trying to blow out a candle with a puff of air. That's similar to what lung function tests measure, especially when checking for asthma. One key test is called forced vital capacity, or FVC. It measures the total amount of air you can forcefully breathe out after taking the deepest breath possible. This number gives doctors a snapshot of how well your lungs are working. In people with asthma, the airways become narrow and inflamed. This makes it harder to move air in and out of the lungs. As a result, the FVC reading is often lower than normal for someone of the same age, height, and gender. When doctors see a reduced FVC, it can be a sign that the lungs are not functioning properly. But they don't rely on FVC alone. They also look at another measurement called FEV1, which is the amount of air you can force out in 1 second. The ratio of FEV1 to FVC is very important. If this ratio is lower than normal, it suggests there is an obstruction in the airways, which is common in asthma. FVC is not just for diagnosis. It also helps in managing asthma over time. By regularly measuring FVC, doctors can see if your lung function is improving or worsening. If your FVC gets better after using a medication called a bronchodilator, it shows that your airways are opening up and that your asthma is at least partly reversible. This is a good sign because it means your treatment is working. If FVC stays low or gets worse, your doctor might need to adjust your treatment plan. Monitoring FVC helps doctors decide if you need more medication or lifestyle changes. It also helps them understand how well your lungs are responding to treatment. Keeping track of these numbers can prevent your asthma from getting worse and help you stay active and healthy. So, in simple terms, FVC is a useful tool that shows how much air you can breathe out and helps guide your asthma care. It's like a window into your lung health, showing both the severity of your condition and how well your treatment is working.